Hi, my name is Stacy Hornby, and today I'll be presenting my research on global health injuries with a specific focus on South Africa. In this presentation, I'll explore what global health injuries are, why they are a major public health concern, and how they impact populations worldwide. I'll also look closely at South Africa as a case study since it faces a significant burden of both unintentional and violence-related injuries. Throughout the presentation, I'll connect these injury patterns to a broader global health issues and explain why understanding them is important for prevention strategies and health system planning. This topic is especially important because injuries are often overlooked compared to diseases, yet they do contribute significantly to disability and premature death worldwide. So, what are global health injuries? A global health injury is any physical harm that results from accidents, violence, or other external causes and has a significant impact on the health and well-being of populations worldwide. Global health injuries are a significant public health issue that affects millions of people worldwide each year. Injuries can result in death, disability, and long-term physical, emotional, and economic consequences. They place a substantial burden on healthcare systems and communities, particularly in low and middle income countries. Understanding the causes and impacts of injuries is more important for developing effective prevention strategies and improving population health outcomes around the world. Types of injuries and dailies. Injuries have a significant impact on the health and well-being of South Africa's population. They contribute to high death rates, particularly among young adults, and leave many survivors with long-term disabilities that affect their quality of life. Injuries also contribute substantially to disability adjusted life years or DALYs, which measure both premature death and years lived with disability. Beyond the health effects, injuries create economic costs through medical expenses, lost productivity, and reduced workforce participation. They also affect families and communities by creating emotional stress, financial hardship, and the need for long-term caregiving and support. Global injury trends. Injuries are a major public health issue worldwide and are responsible for millions of deaths each year. Some of the leading causes of injuries include road traffic injuries, falls, violence, self-inflicted injuries, drowning, poisoning, and burns. The burden of injuries is not evenly distributed across the world. According to the World Health Organization, the most affected regions include Sub-Saharan Africa, South Asia, parts of Eastern Europe, and the Middle East. These regions often face challenges such as poverty, rapid urbanization, limited healthcare access, and weaker safety systems. One country that experiences a particularly high burden of injury is South Africa, which will be the focus of the remainder of this presentation. South Africa country overview. South Africa is located at the southern tip of the African continent and has approximately a population of 63 million people. While it is classified as an upper middle income country, it experiences significant socioeconomic inequalities that contribute to health disparities. South Africa was selected for this case study because it has one of the highest injury burdens in the world, particularly from violence and road traffic accidents. These injuries have substantial impacts on mortality, disability, and healthcare costs, making South Africa an important example when examining global health injuries. Leading causes of injury in South Africa. There are several factors contributing to South Africa's high injury burden. Road traffic injuries are a leading cause of death and disability, often linked to speeding, impaired driving, and pedestrian accidents. Homicide and interpersonal violence occur at a much higher rate than the global average and remain significant public health concerns. Alcohol is a major contributing factor to many injuries, including traffic crashes and violent incidents. Falls and occupational injuries also affect many individuals, particularly in physically demanding work environments. Together, these injuries place a substantial burden on South Africa's healthcare system and communities. Impact on population health. Injuries have a significant impact on the health and well being of South Africa's population. They contribute to high death rates, particularly among young adults, and leave many survivors with long term disabilities that affect their quality of life. Injuries also contribute substantially to disability adjusted life years or DALYs, which measure both premature death and the years lived with disability. Beyond the health effects, injuries create economic costs through medical expenses, lost productivity, and reduced workforce participation. They also affect families and communities by creating emotional stress, financial hardship, and the need for long term caregiving and support. Now, let's take a look at South Africa versus global trends by looking at the chart in front of us. This comparison shows that while injuries are a major concern globally, South Africa experiences a much higher burden in several key areas. Road traffic deaths are already a significant global issue, but rates in South Africa are even higher. The most striking difference is violence related injuries and homicide, which occur at much higher levels than the global average. Alcohol-related trauma is also a major contributing factor. These trends demonstrate why injury prevention remains a critical public health priority in South Africa and why targeted interventions are needed to address these specific risk factors. Preventions in South Africa. South Africa has implemented several strategies to reduce injuries and violence. Road safety campaigns and traffic law enforcement aim to decrease motor vehicle accidents and fatalities. The government has also introduced alcohol regulations to help reduce alcohol related injuries and violence. Community health initiatives and violence prevention programs work to educate the public and address risk factors at the local level. Additionally, emergency medical services play an important role in improving survival rates and reducing the long term impact of injuries. Effectiveness and challenges. What's working and what needs improvement. While South Africa has made progress through stronger traffic enforcement and community based prevention programs, significant challenges remain. Traffic laws have helped improve road safety, and community programs have increased awareness about violence and injury prevention. However, access to trauma care is still limited in some areas, particularly in rural communities. Violence contributes continues to be a major public health concern, and additional resources are needed to strengthen prevention efforts and improve healthcare access for vulnerable populations. Policy implications and recommendations. Injury data helps policymakers identify the biggest health risks and decide where resources should be allocated. In South Africa, data highlights the need for increased investment in road safety, violence prevention, and emergency medical services. Improvements in infrastructure, such as safer roads and pedestrian walkways, can also help reduce injuries. Moving forward, continued funding for prevention programs and data collection efforts will be essential to improving health outcomes and reducing the burden of injuries. Key takeaways. In conclusion, injuries remain a major global health issue and are a leading cause of death and disability worldwide. Through this research, we can see that South Africa experiences a disproportionately high burden of injuries compared to many other countries, particularly from violence and road traffic incidents. These injuries not only impact individuals and families, but also place a significant strain on the healthcare system and the whole economy. While South Africa faces many unique challenges, there are many prevention strategies discussed, such as road safety initiatives, violence prevention programs, and stronger public health policies. By doing these things, there is the potential to reduce injury rates and improve health outcomes. Understanding injury data is essential for developing effective interventions and creating policies that protect vulnerable populations and improve overall public health. Thank you so much for your time and your attention. I appreciate you watching my presentation. You'll see my references here on the right from the World Health Organization, as well as the South African Medical Research Council, along with PubMed Central, The Guardian, and WHO with the daily definition. Thank you and have a great day.